Hi.
Hi, how are
Oh,
you?
I'm well. How are you?
Good. Sorry, technical difficulties.
Always. Always, but here you are. Thank you so much for giving us your time.
Oh my gosh,
I
such an
know you are
honor to be
so
here.
busy. You're a mama of two,
Two
and
now,
it's,
somehow.
yeah, it's crazy. And yet you're
This,
giving us some of your time, and we are so grateful because there are a lot of questions surrounding the whole just motherhood or parenthood world right now.
yes, yes,
And it's a crazy time.
it's
We've
a
never been
crazy
here
time.
before. But I will let you introduce yourself a little bit if there's anything that you want to add, just so people can get to know you a little bit.
Yeah, hi guys. I'm thrilled to be here. Thank you so much for having me. I am such a fan of AMMA, and of you, Emily, and Satya. So I'm thrilled to be here. I have two babies, I have a 3-year-old boy, and I have a 12-week-old, almost 12-week-old girl. So I was lucky enough to have my baby in New York City in early February, just at like, I was just saying to my husband yesterday, like when we walked into Mount Sinai Hospital at that moment, like I was not thinking about coronavirus at all. And I feel so lucky to have had, like we knew about it then, but it wasn't a thing, right? And I wasn't worried. It didn't impact my delivery. It didn't impact the way I thought about my delivery at all. And obviously moms who are delivering now, especially who are choosing to deliver in a hospital setting, can't say that. So I just feel really lucky. And I also feel great to be the founder and CEO of a company, a medical service that is serving people via telemedicine across the entire country. We work with people everywhere. Um, and that, you know, we have a lot of moms, a lot of women patients, members of our practice, and they are able to get all of their COVID questions answered. We have a lot of folks going through fertility
Yeah.
stuff right now, so we're going to answer questions on that today. And we do so much fertility support and optimization at Parsley Health. We do so much hormone balancing. We do so much, literally from PMS all the way through menopause and all the things in between. And just happy to answer your questions. We're an online medical practice that helps you reverse chronic illness, figure out pesky symptoms, and optimize your health. So that's what we do, and we do it for every area of the body.
So amazing.
Yeah.
Oh my gosh. Thank God for you. Um, we have 30 minutes. So I'm just going to let's just dive in together because I have some questions and I know a lot of people do. So that's great.
Yeah.
Thank you for that
Rapid fire.
introduction. We're so happy to have you here. So let's start with, let's say you are pregnant already. This is a crazy time, and we're getting most of our questions are from mamas that are pregnant, that are about to give birth, and they just go, what does this even mean for me? So let's start with, and I know information changes all the time.
Right.
So we'll just go based on what you know today.
Yeah.
What is the risk to pregnant women of getting COVID-19? Are they more susceptible? What's the deal there?
Yeah. So as of what we know today, and yeah, the information changes daily. We have an internal task force at Parsley Health managing all of the information and taking care of all of our patients because we had to create that, 6 weeks ago in order to just stay on top of what's coming out, because the WHO says one thing, the CDC says another, the Times, the Journal, the whoever you follow, the Fox, whoever you're looking at is saying something different. And so it's just a lot to take in. And globally, we are dealing with a pandemic that is unprecedented, that we've never dealt with before. And so the information sharing that is possible is really extraordinary, but then it means that there's information overload. So if you are pregnant right now, you are not, as far as we know, at greater risk. All pregnant women, because of changes in the immune system, changes in fluid balance in the body during pregnancy, are a little bit at greater risk of colds and flus, of viral illness in general.
Right.
But so far, what we're seeing is that pregnant women, probably because by and large, pregnant women are, under 45, so therefore not in a higher risk group. And women who are pregnant can have underlying chronic illness, but oftentimes don't. They're generally like a healthier population, so they're not at higher risk of COVID-19, either contracting it themselves or having any risk to the baby. So if you are a pregnant woman and you get COVID-19, as far as what we know today, your baby is not at greater risk of a birth defect. Your baby is not at greater risk of premature or preterm delivery. There are no known risks as of now to your pregnancy or to your baby if you do contract COVID-19, and then if you're pregnant, you are not at greater risk of getting it in the first place.
I mean, that's really good news, because
Yeah.
that's another question that comes in a lot. Like, can COVID-19 cross into the placenta? And what does that mean? Is it like Zika? Is it like,
yeah.
And
we all went through Zika virus over the past, couple of years, and it's still top of mind when you're thinking about travel and pregnancy.
Sure.
I was pregnant, last fall, and we decided to go to a certain part of Mexico, but it was like, can we go? Even though there hadn't been any noted cases of Zika in Mexico in a long time. When we went, we still were worried about it. So we all have that in our minds. Thus far, there is a small study out of China that looked at 9 infants. So you have to remember, our data set on this is extremely light and limited, which is why this information has changed, because we get new data all the time. But the one study that we have looked at 9 babies. It was shown that perhaps COVID can cross the placenta, but what it did show was that the babies were either unaffected or were very mildly sick, and were not severely ill. And so that is also encouraging. So if you are pregnant and you happen to get COVID-19, even if it is passed on to your baby, as of what we know now, it doesn't look like there's any negative, two negative effects or serious effects of that.
Okay, that's wonderful. So let's say that a mother does have COVID-19 and she gives birth, everything goes well, baby's there in her arms, it's time to begin breastfeeding. What does that now mean? If the mother has COVID-19, how do you protect the baby at that point?
Yeah. So if she has it, and again, it's tough, right? Because a lot of people, especially younger people, are asymptomatic or mildly symptomatic. So a lot of people may not even know that they have it. And then the failure in our country to get widespread testing available is a travesty, in my view. And so mama may not know she has it, right? But if you are actively symptomatic, it is not, and you are breastfeeding either immediately, it's like babies come out and you're breastfeeding, or maybe your baby's a little bit older and you've been breastfeeding and now you know that you have COVID-19. What's recommended is that you do your best not to give baby, make baby exposed. So you wear a mask, you wash your hands. That said, I'm like, as a nursing mom, I'm breastfeeding. I'm like, if I have COVID, how am I not giving it to my baby unless I isolate, right? So it is recommended that if you have it, that if you can, that you isolate and take precautions, and that you pump and that you feed your baby that way. But it is not recommended that you stop breastfeeding. There does not appear, they have not found COVID in breast milk. And your breast milk is chock full of antibodies and immune components that your baby needs to be strong, right? So if you are breastfeeding, if that is your choice, it is not recommended at this time that you stop breastfeeding because of COVID, but that it is recommended that if you are symptomatic, you're coughing, you have a fever, you have shortness of breath, that you do your best to avoid transmitting that to baby and the rest of your family. In which case, if you can self-isolate for that 14-day period, that would be ideal if you can then pump and give baby breast milk that way. Obviously, we know that that is not possible for everyone. And if it's not possible, then it's just recommended that you wear a mask, wash your hands, and do your best, to not transmit. But what we do see so far is that by and large, kids seem to be also pretty healthy with COVID, and also by and large, not getting symptomatic at all, so they can be carriers of the virus and not know it, which is part of why schools are closed. But we don't see kids getting sick except in very specific cases where these children have other underlying chronic illnesses like cancer or immunocompromise, where children are sick and therefore are more affected by the virus. So that's kind of also encouraging, because by and large, from what we see now, if your baby did contract COVID from you, or in a hospital setting, despite everyone's best efforts, it's very unlikely that your infant or a small child would become severely ill from contracting COVID.
That's wonderful.
Yeah.
another question that is coming in a lot. I can read one here from Jessie. She said, "We're trying to conceive again after a miscarriage in March, but nerves are abundant. If we get pregnant again, what could we generally expect for care since clinics are closed still?" And there are a lot of questions about, is it a bad idea trying to conceive right now? We don't want to wait. We want to keep trying, but what does that mean for us?
Oof. So if you're trying to conceive naturally, my recommendation to folks is keep at it, because you know what? If this is your chance and you really want to get pregnant, you know, don't waste a cycle. Like keep, keep going. And there's nothing that indicates that, you know, there's any reason to not conceive naturally at this time. And so now that said, you know, around that 6-week, 8-week mark, when you're going to get your ultrasound for your confirmation of IUP, intrauterine pregnancy, with clinics closed, you know, I do believe that in the coming weeks, for essential care like that, you will be able to go to your doctor's office. It depends on what part of the country you're in. California and New York might be later than the rest of the country, right? We'll have to see. But by and large, you do want to make sure that you can get adequate prenatal care. And so if you're in an area of the country where you can't get that, or we're still under shelter at home, it might make you decide to wait a little bit longer until you're sure that you can get adequate prenatal care. But I wouldn't be recommending that you wait based on the idea that getting COVID could hurt your pregnancy, right? The only thing that's a risk is if you had a very high fever very early in pregnancy, first trimester, very high fever, not COVID related, but just high fever in general. There's some controversial data that could lead to birth defects. There's also data that shows that that's BS. So we really don't know. But you know, if you're sheltering at home, you're not exposed to anyone, you're very unlikely to be exposed or get it or be symptomatic and get that high fever. There's no risk to you getting pregnant. It's more just about the resources and services that are available to you at this time.
Yeah. And I know there's a lot of guessing there because we just don't know. We have no idea. This is such an uncertain time.
And if you're like, oh, I was thinking about getting pregnant like this year, then, you know, maybe wait a beat, maybe wait 3 months or so and see kind of how things shake out. But, you know, we have a lot of members who come to us having had multiple miscarriages, having had being told by their GYN, oh, you'll never get pregnant on your own. We have people with PCOS, irregular cycles, absent cycles. And, you know, we'll digress from COVID for a moment, but we do so much work to help women get pregnant naturally. And we have so many success stories of helping women get pregnant without IVF. And the reason is GYNs, well-meaning, don't look under the hood and ask the very vital question, why can't you get pregnant? Is it because you have low thyroid function? Is it because you have high blood sugar and inflammation, and that has led to polycystic ovarian syndrome, which after age is the #1 reason for impaired fertility now, which is largely metabolic. We have done, is it because of your MTHFR genetics? Is it because your body's inflamed or you have a diagnosed autoimmune condition, which 80% of autoimmune is in women. And so there is so much there that, you know, women are told, and this is just flat out wrong, I'm sorry. Women are told, oh, you're on the birth control pill, you're on for like 12 years, 10 years, 15 years, whatever, just go off of it and next month you can get pregnant. And for some that is true, but for a lot, going off the pill, which has been masking your hormones for all this time, uncovers what your hormones are really doing there under the surface. And sometimes that unmasks PCOS, irregular periods, other issues. And so I always say to our patients, give yourself at least 6 months. Plan for at least 6 months, if not a year. So like if you know you want to be pregnant next year, now is the time to go off the pill, understand what's going on with your hormones. We do a lot of work on genetics, on lowering inflammation, getting people off of inflammatory diets. I have a patient, she told her story on her blog. She had a history of thyroid cancer, had her thyroid removed, and so was on thyroid hormone, had PCOS, weight gain, so irregular cycles, and she was told she would never get pregnant without IVF. We helped her regulate her cycles with supplemental progesterone, and by helping her regulate her metabolism, and she just had her second baby naturally.
Oh, that's amazing.
Yeah. And so listen, IVF's great. I mean, don't get me wrong. Like if that's your journey, that's awesome.
Yeah.
But like, it's kind of a big deal to go through that. And what I
Yeah.
see is we're going kind of 0 to 60 with it, 0 to IVF. And there's just so much work we can do before that, so that if you can get pregnant, great. And then if you need that assistance at IUI, IVF,
That is
awesome.
fair.
Let's
Yeah.
refer you to that and make sure that you're healthy through that process, because that's can be a physically challenging and also emotionally challenging thing to go through.
Yeah.
For sure.
Oh my gosh. Oh, thank you for the work that you do. This is so important. So important. So now that we're talking about IVF, let's go down that path a little bit, because I would love what the new guidelines are for IVF, IUI, ovulation induction, egg freezing, all that stuff. Like, what is happening in that realm right now because of restrictions and whatnot?
So for those who are kind of in the middle of a cycle, what we've seen is that it's recommended that you continue. For those who are just about to start or had a planned transfer, the guidelines are to wait. And I think from my understanding, that's mainly around just medical resourcing, the risk of going into medical settings if you don't have to, and we expect those guidelines to change as we flatten the curve and as shelter at home guidelines are changed over the coming weeks and months, depending again on where you are. So it's recommended again to, obviously, if you're in this process, your doctors are guiding you, but that if you're kind of in the middle of it, keep going. But then if you can take a beat before you've started, to wait.
That's great. Okay. And same thing too, I read something about if you are about to, if you are mid-treatment, or if you are about to do chemotherapy, let's say for cancer, and you want to do egg freezing or freezing of sperm before that, that's possible to do whenever you need to, right? Because that's considered.
Yes, absolutely. So it's really the transfers that they're recommending holding off on, the embryo transfers versus fresh, or whether fresh or frozen. But they're if there's a time like sorry.
Oh, bye.
You know what, guys? This is what happens when you go live in your bedroom. My phone didn't break.
I mean, my bedroom too.
Not go.
Let's see. Did we lose you, or are we just? Oops. Here we go with technology again and again and again. We lost you for a second, Robin. You're frozen. Oh, she left. Okay, so let me just turn the comments back on so that I can catch her. As soon as you pop up in the comments, Robin, I will bring you back in. Oh, there you are. Oh, but I can't. Unfortunately, I can't click on the requests. Oh my gosh, this is my backyard again. I mean, come on. So, Robin, I'm going to need you to just pop up in the comments saying hi, and then I'll bring you in that way. Isn't this amazing? All this information. There you are. Wait, why can't I click on you? There you go. Go live. Here we go. Thank goodness for women like Robin. Yay!
Guys, this is what happens when you kick over your tripod in your bedroom / office / workout area / All right, I'm back. I'm okay.
You're back. You're okay. We're all okay. Here we are. Let's get back to it.
Back to IVF.
Back to
COVID-19.
You were finishing a thought on that, weren't you?
Yeah, I think just that, anything that's timely, like cancer treatment, you would want to go forward with freezing your eggs. But if you can wait.
Right. That makes sense. So, what is something that we can do? I mean, pregnant women, or really anybody, what are great things that we can do to protect ourselves? And I mean, we know a few of the things, but I would love to hear from you if you have any extra advice. What can we do to protect ourselves to not get COVID-19?
Yeah, so there's prevention, right? And then there's immunity. So prevention is things like washing hands, wearing masks out in public, which is really about you not spreading it to other folks versus you getting it. And avoiding people who are sick that have been exposed, right? So that's it. And then staying home. Those are the things for prevention. In terms of boosting immunity, first of all, food is nature's first supplement. So if you're like me, I have the privilege of being able to work from home, but of course the snacks are ever present. Sugar, refined flours, processed foods, these things deplete our immunity, and fresh fruits and vegetables, whole foods support our immunity. So with all of the phytonutrients, antioxidants, plants are full of these things. And so that's important. Get a hold of your diet first. And then in terms of supplements, there's a few things that you can take that everybody can take. Vitamin D3, K2, which take 2,000 units a day. You can take more. I take 5,000 because I know I'm low. Most people spend most of their time indoors are low.
Yeah.
You can take vitamin C, 2,000 milligrams a day. We have a supplement at Parsley called Bodyguard, which has got vitamin C, vitamin A, zinc, and then also echinacea, elderberry, astragalus, some of the herbal supplements that are helpful in the body fighting off an infection. We do recommend that you stop some of those herbals if you do get symptomatic, meaning if you are having a cough or fever, then we recommend you stop, because some of those symptoms are coming from the activity of your immune system, and we don't want your immune system to be even more activated. But before that, if you're not symptomatic, then you can take them. I don't recommend those herbals during pregnancy or breastfeeding. So if you're currently pregnant or breastfeeding, we're just very conservative at Parsley Health because most of the herbs haven't been studied in pregnancy or breastfeeding. A lot of stuff hasn't. But you can safely take your zinc, your vitamin C, unless you're taking like crazy high dose vitamin C. We do get that out there, like, oh, taking like 20 grams, crazy amounts of vitamin C. Wouldn't do that in pregnancy, but you can take, 2 grams a day of vitamin C. You can take your zinc, 10 to 20 milligrams a day. Your vitamin D3, K2 is actually really important in pregnancy. It was recently shown that your child's long-term dental health and bone health is really important, that you take vitamin D during pregnancy.
Oh, wow.
And the amount in the prenatals out there is like bogus. So everyone's like, oh, there's some vitamin D in my prenatal. And I'm like,
good.
no, there's like a fairy dust of vitamin D in your prenatal, and you're not getting outside. You're not getting that sun, depending on where you live or what time of year it is, or if you're like me and you just work in an office or in now my bedrooms, right? So it's really important to take vitamin D3, K2 during pregnancy, and just the herbals avoid during pregnancy and breastfeeding. I'm also taking NAC, N-acetylcysteine, which, none of this stuff has been studied in COVID specifically because it's too new, but these things have been studied with other viral illnesses and colds and flus. And N-acetylcysteine, NAC. I'm taking 600 milligrams twice a day. You could also take 900 milligrams once a day. Either way, that has been shown to help fight off certain viral illnesses. And NAC also powers up your body's most important antioxidant, glutathione. So the best way to get glutathione is actually to take NAC and have your body make it versus taking glutathione itself, at least if you're going to do oral.
Oh, that is so awesome. So that was lots of amazing information.
Lots of intel.
It's so good. So just know that in the link in my bio, if you click on that, you can sign up for our AMMA emails, and we will be emailing the recap of everything that we've discussed today, as well as the replay of this live. And also, there are a lot of people asking about Parsley Health. So where can they go if they want to read up more on this amazing thing that you created, and how would that work?
Yeah, so we're online, parsleyhealth.com, and right now we're running like our most amazing sale ever. The code is friends and fam for $400 off. That is almost 25% off our annual membership. So it's like the best deal we can run. We just want our medicine to be as accessible as possible. It's only going to be around for the next couple of weeks, not even this month. So however long April is, April feels like it's 500 days long, but apparently it's still 30 or so.
Is it still 30?
I don't know.
Crazy.
Good question. But parsleyhealth.com, sign up, join us. Our doctors are working with you across the country. We do an in-depth evaluation. We could do diagnostic testing. We ship the kits to your house. And then we put you on a path to deal with all of your chronic health issues, whether it's pregnancy, fertility, breastfeeding related, or whether it's something totally different, or whether you just want to optimize, or you want to know if you have one of the underlying chronic conditions. I mean, this is the crazy part. The things that make us at most risk for getting sick from COVID, heart issues, blood sugar issues, inflammation, immunity, a lot of people are walking around with and they have no idea.
Yep.
And this is stuff that we need to proactively test for, and then we'll give you a
Mhm.
plan to optimize your health from there. So friends and fam is the code, and you can follow us at Parsley Health. We also have a great guide to COVID-19 that has all the supplement recs in it. So
Oh,
parsleyhealth.com/COVID-19. Sign up, download the guide, and the guide written by our doctors and has like everything I just talked about. Not the IVF stuff, fertility stuff exactly, but everything around what supplements to take, how to protect yourself, how to manage stress, all that is in the guide.
oh my gosh, amazing.
Yes.
So
And it's free.
parsleyhealth.com.
Yep.
And for this live again, and for all of our other lives, go to weareamma.com. And yeah, tons of information for you about all the things. We're here for you.
Thank
Robin,
you.
this was so amazing. Thank you for your time and all your wisdom and your love. And thank you
Oh my
for
God.
what you're doing.
You.
Means
Thank you
so
for
much.
having me, and thank you for being such a guide and a light to all of us mamas out there. We all need each other, and
We do.
community and love more than ever. So we're
that is
all in
so
this
true.
together.
We're all in this
Yeah.
together. And thank you to all of you who joined. We love seeing you here, and continue to watch our lives. We're going to continue to bring you lots of good information about all sorts of stuff.
And if I
Bye,
come back,
everyone.
I'll try not to knock the phone onto the floor.
Man, thank
Dr.
you,
Berzin here.
Bye, guys.
Bye.
Thank you.